Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. A lot of the work I do in helping people sell homes is with seniors who are moving into senior living communities. A lot of times they're moving from out of the area, and when they move into the community, they don't have a primary care doctor anymore. And so what's the solution for that? Well, here to tell us about a wonderful solution are Hillary Fields and Rhonda Provenzel from Pine Park Health. How are you guys doing today?
Really good. Thank you so much for having us.
Yeah, my pleasure.
Great.
So I love what you guys do. It's unique. I've never seen it before, and so I want to talk all about it and tell our audience all about it. Tell us about Pine Park Health, sort of the history and how it all started.
So Pine Park Health is an on-site primary care and senior living. It started just in 2019, really, with the whole COVID situation. It was such a need. And it actually was born as a tech company. George Cassin, the owner, was creating a device to install into senior living to help with falls and detect certain needs in the community. And he actually had to stay in the community waiting for a shipment to come to install. And he was in the community for, I think it was a couple of weeks, and quickly learned that these residents did not need another device. They really needed more hands-on care. So that's sort of how Pine Park Health was born.
Got it. So he probably saw that maybe people weren't seeing their primary care physician, maybe didn't have a primary care physician. And a lot of times too, even if they're in assisted living and they're getting assistance for daily activities of living, but they're not getting the ongoing medical.
Right, and it is difficult for them to get to the doctor. So having that on-site presence just makes it so much easier for the residents and the families.
Right. So speaking of which, what kind of impact does it have for seniors that you've seen out there?
So one of the things that I've seen that really works the best with our seniors and helping them with their health is the ability to be in their apartment once a week or as needed. In instances that I see it working the best, really, just for example, is new medications, right? So we want to take medications. Most people, when they get to a certain age, are over 12, 13 medications. And it's a proven fact that once you get that high, your equilibrium starts going off. You start falling. When that stuff starts happening, you go to the ER, you go to skilled nursing, and every time they come back to us, their new baseline is much higher than it used to be. And so we really work on cutting down that medications, finding the medications that they really need, and then being very proactive. I'm not going to wait 6 weeks to come and check you and see how that new medication is. I'm there the following week. I'm checking your blood pressure. I'm checking your weights. I'm checking your blood. I want to see what that medication is doing and how it's helping and affecting you. To prevent any unnecessary crises from happening. My seniors don't need to leave the community anymore. They don't need to wait for primary care. They get to see their doctors, most of the time the same person every single week. So they're creating a bond, they're creating an understanding. They're not scared of expressing how they're really feeling because they've created this connection with their primary care physician. We're really taking it back to how it used to be, that in-home, bedside, I'm your friend, I'm the one you can rely on, I'm the one you can trust, to have them live the happiest, healthiest until the very end.
Which, and again, with the families who are involved with their seniors and their loved ones, they probably feel really good knowing that the medical provider is going to be there once a week to look over their parents, their loved ones, to make sure they're getting the care they need. So it's basically house calls.
And it's a great point that you said, Bryan. One of the other things that we do that is just amazing is we have what we call a care navigator. And that care navigator supports our patient and the family. They connect everyone together, taking all the specialists and all the different family dynamics, and they really create that wheel around each and every patient. That wheel is separate and different for each and every patient. Our statistics, most primary care physicians are going to have between 1,800 and 2,000 patients per primary care. We top off at about 150.
Wow, that's a big difference.
That's a huge difference, right? So they're able to really know. I mean, when someone calls and says a name, we know who that person is.
Yeah.
We're not
It's
checking
very
a file.
person-centered care.
Right.
Very, and it's what's important to the resident and the family. So
Yeah.
it really brings that, like
Yeah.
you said, how it used to be.
Well, and oftentimes too, whether it's a senior or anyone else, they oftentimes, something hurts, but I don't need to go to the doctor. I'll wait. I'll put it off, and then it builds and gets worse. But that's if they have to physically go to the doctor. Then if they have to get on a transport or a bus, get transportation from the community, they're less likely to do it. But if someone's coming in, they are more likely, I would think, to go see the doctor and say, I don't want to bother you, but now they're talking about preventative care versus sick care.
Exactly. And to make an appointment with your primary care, if that's not on site, I mean, we all know sometimes you're not getting in that week.
Right.
So it really is about convenience and continuity of care.
Right. And how do you get your medical providers?
So Dr. Kendall Cannon is our chief medical officer. She pretty much handpicks our providers. It's a pretty big process because it is very different than just regular medicine. So the interviewing process is pretty in depth, and we have a very tight-knit team, especially here in San Diego, because we all kind of built up together. So it is special because it is very personal care. So she handpicks them.
Got it. And one of the things that people are going to ask, probably one of the first things they're going to ask is insurance. How do I pay for this? What insurance do you guys take? So what do you take?
The other thing that's been just remarkable is a lot of doctors that do go into communities pretty much just take Medicare and PPOs. We have contracts with a lot of HMOs as well. So we're able to take a very large number of insurances, which is very helpful in communities. The only one we can't take is Kaiser.
Right, exactly. Okay. And you also have an urgent care program. So tell us about the urgent care program.
So the urgent care program is really set up to help those patients that we have that maybe have a fall or a skin tear or something where most communities are just going to call 911. And once again, we want to prevent that admission to the hospital where the baseline gets brought way up. And so it is a call to us, and we will send out a care navigator. We will assess the situation and see if we really need to do that right to the hospital. If not, we will do kind of what we call a rapid response, to where we might utilize the nurse or a medical person inside the community to help us with the video so we can get right on it right away. We can be out within, we say 4 hours, but it's really more like 30 minutes to an hour, right? To help with the skin tear, to make sure nothing else is going on. And then, of course, if the ambulance is called and we do have to go, then we do what we call an EMT orientation. I don't know the right word to say for it, but where we will give all of the medical files to the EMT. We'll let the EMT know this is what's going on, this is their history, and then once they get to the hospital, we connect with that doctor at the ER and let them know, we're here, this is all of their files, please communicate with us. And then once they get out, we facilitate all of that also. We check the medications. We go right back to let's see if the medications you got in the hospital is something you need to keep taking.
Right. This is a complete solution, a complete medical solution for seniors who are living in communities. I think it's fantastic. So Pine Park Health, all the information's on the screen where people can go to your website, learn more about all the wonderful services you provide. Rhonda, Hillary, thank you very much for joining us.
Thank you so much.
My pleasure. Thank you.